How to carry out an antigen test using the Panodyne FluA and COVID-19 test kit. Work with a clean, flat surface and sanitize your hands. The test kit is purple and contains a swab, interpretation card, test tube with lid, cassette test, instructions, and a diluent. Open the cassette test and place it on your flat surface. Pick up the test tube, remove the lid, and place it in the designated holder on the tests box. Remove the lid of the diluent by twisting the cap, which should easily break off. Squeeze the diluent into the test tube and set aside. Now it is time to take a sample. Open the swab, be careful not to touch the sample area. The sample can be taken from the throat or nose. For the throat swab, ensure that the swab gets to the back of the mouth towards the tonsils. Avoid touching the tongue and the teeth. Now the nasal sample, put the swab into the nostril until there is resistance. Rotate it at least 5 times before removing. Put the swab into the test tube. Rotate it 10 times. Pinch the swab whilst in the tube before gently removing the swab. Discard of the swab safely by placing it into its original packaging. Place the cap on the test tube. Now your sample is ready for testing. Put 3 drops of the sample into both sample areas on the cassette test. Wait until the red C line appears to ensure it is valid. Then set a timer for 15 minutes. Interpret your results. A red C line with a red or pink T line is a positive result for COVID-19. A C line only is a negative result. A T line only or no lines is an invalid result. A red C and B line, C and A line, or C, B and A line is a positive result for the flu virus. A C line only is a negative result. No C line means it is invalid. To learn more about our test kit, visit our website at www.rapidfiresupplies.co.uk.